Hi, my name is Kent Bond. I'm a physical therapist. I've been in practice for 22 years and 5 years ago incorporated the Shuttle Balance system into my clinical practice. Primarily, our largest use is with our anterior cruciate ligament patients and our total knee patients. However, we certainly haven't limited it to that population. We use it a lot with our shoulder patients with aggressive strengthening stabilization of the rotator cuff, the core, and the scapular stabilizers. But we've also incorporated a lot with our spinal patients, our pre and post surgery, just again trying to get improved balance, proprioceptive integration of the appropriate muscle groups for core strengthening. It gives us a wide variety of applications based on height of the platform, narrow platform, and it's pretty much up to the clinicians. Creativity is their only limit for what you can use it for.
Kent, how would you handle an ACL? We have an ACL patient here.
Okay, come on in. So initially, the beautiful thing about this machine, unlike a bicycle or something like that, that would be something I would like to use, but day one, she could be still with sutures and I could have crutches. I can have them just walking over this just to get their confidence. I want them to have a positive experience from physical therapy. So I might just have them stand up here on the platform, and then what I'm going to do is I'm going to let you hold up here. So let's say that she's day one, she might even have her brace on, but I just have her step up and it's onto the platform, and then step off of the platform. Forward. Yep, so come on forward and step off. And so I'll do that a few times, and then let's say that she's been doing this for 2 or 3 sessions. Now I'm going to say, let's go ahead and go through here. So now maybe she's 1 week, and I'm just going to say, now I want you to step up on there. I want you to get good balance on there. I want you to step off there without using your hands. So can you step down here for me? Just like that. So we'll progressively, now if she can't do that, then we're going to tighten things up, but we're always going to have success. So, as they progress, because this ACL patient that we need to get back to playing soccer or downhill skiing, I'm going to let her know that our goal is we're going to have this platform about this high when she's done with her ACL. She's going to be able to jump from the ground up onto that platform and jump off. But because I started her day one on it, she's not afraid of it because I've always done things to allow her to success. I've never let her fail on it, so I can gain her confidence as we progress with our ACLs. But the beautiful thing is that day one, they're not able to make a complete revolution on the bike. It's hard to do leg presses, so they're doing straight leg raises and real simple exercises like that. But day one, I can start working on balance. I can do some weight shifting. So again, let's have you step up on here like if you're day one. And I didn't like the way she walked in with this real stiff gait. So I'm going to let you, in fact, I'll probably let you put your hands just hovering like that. I want you to weight shift over, let's say that this is your strong leg, okay, your non-surgical leg. So have you just take that left leg and just bend that knee for me. And go ahead and try to pick your foot up and back down. Let's do that 10 times. So we're just getting her to unload and bend that knee. Get good control. So now she's really anxious about this leg, so I'll let her hold on. Now I want you to weight shift because you haven't been weight shifting over that leg, and I may cue her to weight shift over that leg. Pick that right leg up for me and back down. And weight shift over. So we can do weight shifting things, transference of weight, and do those kind of things. And again, she would have success with that. And then, so when she's walking out of my clinic today, now she has good knee flexion, knee extension, good weight shifting, and she feels like, and she's going to get tired. Her core is going to get tired, and she's going to feel that how hard can that be? And then when she's leaving, she's going, wow, that was a workout. So again, we can do that day one. And all of a sudden now we're 3 or 4 weeks into it. I can have her standing, weight shifting on that leg. We can play catch. We can do movements. And exactly. So I can have her, I'd stand here, and let's say that now you're 3 weeks, okay? You've been progressing really well, and you have no crutches, you have no brace on. Have you stand on that left leg for me. Exactly. Put it in the center of the platform. Yeah, put it in the center. Get your balance. Eyes open, and once you have, then we can just play some catch. So I'm just going to toss the ball to you. Exactly. So that hip's going to be weak. That leg's going to be weak. But you saw when she was I don't have to worry about having two aids here to keep her safe. She can grab and protect herself. So again, get your balance, and then we can play catch. Exactly. So we can do that kind of stuff. And then we'll stop, let her rest, and then we'll try that again. So that's one thing. And then like I'd mentioned on some of our soccer players, once she's ready for that, we're going to have her weight shifting, and she can be kicking soccer balls with that drill. If she's a goalie, we're going to be throwing balls at her and having her try to simulate blocking the ball out of the goal. So let's have you turn around and face this way so we can see you here. We can work on if I wanted to, so once she started getting real confident with that, I could change the chains and work on creating an unstable surface that way. But also watch what happens here. I want you to get your balance right there. Now, nothing's going to happen, but what I want you to do is I want you to close your eyes. Don't let me move you. So I can do these kind of things. And once she makes that look simple, now open your eyes, get good control. I want you to stand on, we'll make believe it's your right leg is your strong leg. So go ahead and get your center leg there. And let's stand on that left leg and get your balance. And then I can do the same kind of things. Eyes open, always start with eyes open. And once I look like I can't really move her, go ahead and close your eyes. Don't let me move you. Exactly, so we challenge her like that. Eyes open, eyes closed. And go ahead and take a rest there. Let you step down if you'd like to.